Hello, everybody. This is Dr. Vasi with yet another episode of Desi Table Talk. Please like us, subscribe us, and share us, and hit the bell icon so you get notified whenever we post a new video. This show, before I start, this is purely informational. This is not intended to create a doctor-patient relationship. And if you have any medical symptoms or concerns, you should always contact your primary care doctor. And so having said that, I would like to introduce my host today. I have Dr. Naveed Sheikh, who is with me again to discuss more about COVID, but this time we are going to talk about COVID vaccination. Dr. Naveed Sheikh is a pulmonologist and an intensivist, and if I were to call him a real hero, that would not be falsifying anything, because he's been on the front line of COVID management and treatment, and he's been in the hospital treating patients and seeing what we have only been reading or hearing about. So I would welcome Dr. Naveed Sheikh back to the show.
Thank you so much for your kind words, and I appreciate that you gave me being a host of the show.
Thank you.
You called me the host, by the way. That's okay.
Well, so, he's the host because he's going to do most of the talking. I'm only going to ask questions. And by the way, Naveed is a fairly new friend to us, but a dear friend. We met at Hajj. We were there together 2 years ago. And we were talking about COVID and how it has changed all these gatherings, and especially the big gatherings like Hajj. And I'm sure a lot of you would like to go if you have not performed Hajj yet, or would like to go back if you had a good experience the first time around. So we will be talking about those in the context of COVID vaccination. And the reason we are talking about COVID vaccination is because there is so much misinformation out there, and there is so much resistance in folks when it comes to getting vaccinated. So before I take up too much of the time, I would like to start with my first question. And the question basically is that everybody is asking, okay, there are 2 or 3 COVID vaccinations available in the US. Which one should we go to? Which one is better? And I will pass that question on to Dr. Sheikh.
Thank you very much for the question. This is a very common question that I'm getting these days, and at this time, the availability of vaccine is a big problem. I'm hoping in coming months it would get better. But right now, if you qualify to get a vaccine, then please go and get whatever vaccine which is available to you. It doesn't matter which one. All of these vaccines that are FDA approved right now, available for the public, show reduction in mortality, which means the chances of dying with COVID goes down if you're vaccinated.
So you can still get the disease, but the mortality rate or the chance of dying from the disease goes away or goes down.
Right. So if you are vaccinated and you have immunity against or the immune component in your body which are ready to fight off the virus, if you are exposed while your body is fighting off that virus, you still can technically transmit it to other people. So yes, you can be exposed, your body would fight off, hopefully, but you can transmit it to other people, and that's another reason to keep wearing the mask and washing hands and be careful even if you are fully vaccinated.
So yeah, that was going to be my second question, but you answered it already, which is great, because people feel like when I get vaccinated, I don't have to wear the mask, I don't have to stay away from folks, no need to keep social distancing or wash my hands, but none of that is true. So basically, if you get vaccinated, please make sure that you're still following all the guidelines, because you can still be a carrier. So the other question that, there have been so much in the on the social media, we come across all kinds of things where people are afraid to get vaccinated because they feel that somebody is going to control them because there is some kind of a microchip which is being injected and they will be tracked. And some of the younger folks are concerned that that it may somehow affect the fertility rate down the road. So is there any truth to any of these myths?
So when I was vaccinated, I looked at what they were injecting me. It was a liquid. So I did not see any chip being injected into my arm. And as far as being controlled by somebody else, I think main concern people have is that if that virus would go into their DNA and that would change their DNA. And one person asked me, would I turn into Wolverine? No. A couple of FDA approved vaccines that we have, they are mRNA. They're not DNA vaccines. So they just give body a signal to be prepared that if the virus comes in, the body is ready.
So the body can fight off.
The body can fight off. And what was the third component of the question? If they can be tracked? Infertility. So every medication has its own side effect. To the best what I know, I have not heard anybody who have experienced infertility because of the vaccine. There are many other things or many medications and even cigarette smoking that can lead to infertility, but people do it all the time knowing that.
Yeah, so that's a good way to put it, because people don't care about smoking where they know it will cause cancer.
Yes.
But they're very concerned that they're not going to get the vaccine because it may make them infertile. But so sum it up, basically what we are trying to tell you is that the vaccines which are out there are fairly safe, and none of these so-called myths are true or have been proven by any of the studies that have happened. So once a person gets vaccinated, like you have been vaccinated, I've been vaccinated, so does that mean we do not need to wear masks? We don't need to keep social distancing? I mean, can we start going to bigger gatherings and start to invite folks over to our homes?
So in this regard, I would encourage everyone to follow CDC guidelines, which are changing pretty frequently. There are recent guidelines that came out about people who are fully vaccinated, and the definition of fully vaccinated is after they get second shot, if they're getting a vaccine which needs 2 shots, so at least 7 to 14 days after the second shot, that's when you consider that you're fully vaccinated and probably have immunity. After that, right now, CDC has said that people who are fully vaccinated can meet indoors in small gatherings. As far as bigger gatherings are concerned, which would include some non-vaccinated people, vulnerable people, at this time I don't think that these are safe, but I would encourage to continue to follow what CDC recommends.
Okay. So the other bigger question is, and it's very difficult, and I'm sure it's difficult for you to answer too, because vaccination has just started. We have not even had 10% of the population vaccinated yet. But do you think life as we knew it would ever come back, or we would ever go back to the same kind of lifestyle that we have been used to? And this is particularly for Desis whose life revolved around bigger gatherings and a lot of food and a lot of hugs and lots of handshakes. So do you think that is happening anytime soon?
So to get back to that lifestyle, we need at least 70 to 80% of population immune, which means either they have gotten the disease itself and have recovered, or they are fully vaccinated. To the best I know, I think right now we are at 30 or 40%. So we just have to wait how long it's going to take. I mean, it's my personal thought is that it's probably not going to happen at least towards the end of this summer. But we would just have to stay tuned and see what CDC recommends and when these restrictions would be removed. But I'm pretty sure that sanitizers and masks would be a part of our grocery list for a long time.
For a long time. So some of the other questions that people ask, one very important one is if somebody has had COVID, first of all, are they not immune, and do they also need to be vaccinated against COVID-19?
So right now the idea is after COVID disease, people who had asymptomatic disease or mild disease may or may not have developed antibodies, and if they did, they might be their titers, maybe their levels may be low, and they may not last long. So people who have gotten COVID disease, they are still encouraged to get vaccinated. And actually, it is said that if somebody has gotten COVID disease and then they get vaccinated, their immunity is quote unquote robust.
Really? Because the other question, which is also related to this, is related to the immunity that is produced by the vaccine itself. So, and I know it may be a difficult question to answer because it's a new vaccine, but do we know or do we have any idea that people who are now getting vaccinated against COVID-19, how long their immunity will last?
This is the question which is yet to be answered. I don't know the answer to it, and I think nobody does. I think the companies that in agencies who are looking over these things are they're monitoring the titers or the immunity level on the people they vaccinated, and they will see when those levels will drop. And I think there would be newer guidelines come out when they think it's the booster dose is recommended. We know just like flu, we get flu shots every year. So I don't know if we're gonna have COVID shots every year, every 2 years, every 6 months. I don't know yet.
Well, that is interesting. And as somebody said, and I'm quoting somebody else, they said that we are living an experiment. So because this is a new vaccine, we don't know much about it. These vaccines have been out for less than a year. So we don't know how long the immunity will last. And as Dr. Sheikh said, that maybe there will be some kind of monitoring down the road for folks who have received the vaccine. We may end up getting our antibody titers done at some point to see if those titers last for a year or more, but we should be ready for an annual COVID-19 vaccination. The way things are, we don't know because it's a new disease, it's a new vaccine, things are changing every day, and we should know more. Hopefully in the next few weeks there should be more data coming out. So with that, I would like to thank my guest and host, and that's Dr. Naveed Sheikh, who took out time from his busy schedule and gave us some really important information on vaccination as well as COVID-19. And as I've always said, this is basically an informational show. This is not intended to provide any medical advice or treatment. And if you have any symptoms or questions or concerns, you should be talking to your primary care doctor. We, on the other hand, do invite suggestions and questions. And even for future shows, we would love to see what you would like to hear about. And so with that, if you have anything to add before I end the show, I would ask Dr. Sheikh to...
Thank you so much for inviting me.
So no more questions or no more information. So with that, I would end this show, and please keep watching. Please like and share and subscribe to our channel, and be healthy, be safe, and stay tuned.